Kevin Host, SVP of Walmart Health and Wellness Pharmacy, and you're listening to the CPG Guys podcast.
Welcome to the CPG Guys podcast. Your hosts, Shri Rajagopalan and Peter V.S. Bond, explore how brands and retailers engage consumers in an increasingly digitally driven world. And now, here are the CPG Guys. Hello and welcome to the CPG Guys podcast. I'm your co-host, PVSB, and when I'm not working on this podcast, I serve as head of industry and client engagement at Flywheel, the commerce accelerator division of Omnicom. Now, my co-founder and co-host, my BFF Shri, well, as we record this episode, he's in LA. He is hosting a number of panels at the next Media Days conference, and so he can't be with us. I will, however, be seeing him tomorrow because I am catching the big silver bird out to LA so we can catch the first two games of the Yankees-Dodgers series. We're going to, if our accountant's listening, it's a board meeting. So that's how the expense is going to be listed. And if you're in the IRS, we're not really going to the game. I'm just kidding. Maybe we are. But in any event, if you're, Shri, if you were here, we would make mention that you should certainly be following his two incredibly successful pop star daughters, Rhea and Lara Raj, on their meteoric singing careers. There are links to their social media profiles in the digital liner notes of this episode. For our audience, we're really grateful you joined us today. What would make us incredibly happy is whichever platform you choose to listen to this podcast on, Apple or Spotify, click the follow button. That way, when new episodes appear, as they do twice a week, they'll appear into your stream and you'll be able to listen to us very frequently. And hopefully you're finding us to be incredibly educational and entertaining at the same time. And now let's get to the reason why we're here today. Joining us for this episode is another guest from what we here at the CPG Guys fondly call the world's most elite retailer. Of course, we're talking about our friends at Walmart. We're diving deeper into healthcare and wellness with our guest today. He's the Senior Vice President of Walmart Health and Wellness Pharmacy. His name, Kevin Host. Kevin, how are you? Welcome to the show.
Hey, I'm doing great, Peter. Thank you so much for having me. I'm excited to be here.
Well, we love having guests from Walmart. You are by far our most frequent visitor in pure numbers. We've had a lot of your colleagues at the Walmart Connect side. We're always great to have people on the merchandising side. Before we get to the questions that I prepared for you today, would love if you could give our audience a brief overview of what your role is at Walmart.
Sure, absolutely. Well, I'm a trained pharmacist and I've been here just almost 4 years now, but basically I oversee anything with a drug in it. So we've got about 4,600 pharmacies across our supercenters, neighborhood markets. We also have 5 central fill pharmacies, as well as a mail order / pet med pharmacy and a specialty pharmacy. So I oversee all of that. And then also my field teams oversee the operations of our roughly 3,000 vision centers.
That's great. That's very helpful. And I'll make mention, Kevin, that I spent a number of years myself working at a large national pharmacy retailer. So I have a bit of an experience. In fact, I spent a couple of days when I was first onboarding working behind the counter. I wasn't allowed to touch anything. I could watch things, but I understand what a big challenge that is. So it's really exciting. To our audience, if you want to learn more about Kevin as we go on with this conversation, just check the digital show notes of this episode. I'll make sure to include a link to his LinkedIn profile and, of course, Walmart's website, the corporate site where you can learn more about the business. So let's get on with our conversation. So, Kevin, you made mention of the fact that your career is anchored on pharmacy. Tell us how different it is to lead a pharmacy versus what's going on in what we call the front of the store, the merchandising, non-pharmacy part of the store. What are the drivers that you look at for success in your business?
Yeah, it's a great question. And, part of my history is going way, way back. I got my start in retail and managing the front end of drugstores, which is how I discovered pharmacy in the first place. And so I haven't done it for a long time. And, the professionals that we have here at Walmart and the merchants are just absolutely incredible. But I'd say we all row the same direction around here. At Walmart, we're people-led, tech-powered. We're an omnichannel retailer, and we're dedicated to helping people save money and live better. You will hear that day in and day out. We all take that very, very seriously. And so for that reason, we're similar in many respects. Getting access to products and services that people need at affordable prices. That's what we all do. The nuances can be a little different. And, as you may know, in the world of pharmacy and the world of healthcare generally, you've got a lot of third-party payers. We may have different or more regulations. Either way, though, the bar for trust is very high. People trust that we'll have the right products on our shelves. They trust that we'll deliver their orders to their house when we say we will. And within healthcare, people are also trusting you with their information, very personal, intimate information, and their lives in many cases. So we want to deliver on that across the board, no matter what it is. And, I think that kind of sums up a little bit of how we think about it. Now, Walmart has been in the pharmacy business for over 45 years. We had our first pharmacy in Springfield, Missouri, 1978. And today, fast forward to today, over 90% of the population is located within 10 miles of the Walmart pharmacy. And so, in many cases, we're also providing things like $4 generics, vaccines for flu, shingles, pneumonia, health screenings, and we're open 7 days a week. So because we're there for our communities and our customers, we're also making sure that we continuously remodel and renovate. And so by the end of 2025, we'll have remodeled and upgraded nearly 2,000 of our locations across the country, just to make sure that we're meeting the evolving needs of our customers.
You touched on something really interesting that I talked about in my past working at a major pharmacy retailer, and that's around trust and privacy, right? And so when I think about that, I'm sure like you, there you have privacy officers and concerns and the firewalls between the two businesses in order to honor the HIPAA legal requirements on maintaining the sanctity of the privacy of medical information. So in light of that, what is the connection between pharmacy and center store, and what kinds of cross collaboration can exist between you and some of the other leaders that are outside of the pharmacy business at Walmart?
No, I think you hit the nail on the head, Peter. There is a lot of firewalls and a lot of security, and we do honor the privacy of our customers, whether they're shoppers or patients. That said, there's a huge demand for omnichannel shopping experience that really meets our customers' needs. We have 150 million people that walk through the doors every week, and we're in just a really unique position to provide high quality healthcare in one single convenient location. So our customers will shop for fresh food, as well as an assortment of wellness products, OTC supplies, household essentials, and they get support from those community pharmacists in the form of health screenings, vaccines, prescription pickup, and more. So we don't share information unless our customers want us to. And we do that in a way that respects their wishes and their desires. And so, for example, we just launched pharmacy delivery. And one of the things that we do is we allow them to link their prescription profile with their e-commerce profile. And that enables them to shop us in all of their needs in a one-stop shop. This was when we launched pharmacy delivery earlier this year. it was the number one most requested service by our time-sensitive, busy families that shop us online and in the store. So we're the first and only retailer to integrate prescription medications with groceries, general merchandise, all in one online order delivered, to their home, sometimes in an hour or less. And that's available same-day delivery across 49 states, reaching hundreds of millions of customers. That's one example. Pet pharmacy, pet services. I mentioned that I have a pet pharmacy that I'm accountable for. And we also offer very affordable pet prescriptions as well as pet insurance for our furry family members. And the pet category is really, really dynamic. The projected annual spending on that is 7% annually by 2030. And so, by doing that, we also, part of what we also do is we widen access to care in terms of in-person and virtual veterinary care in certain stores of ours. I could go on and on. Things like diabetes, nutrition counseling. Our pharmacists will provide that, as well as clinical support for diabetes management in many of our sites across the country, and help customers make healthy food purchases that help them manage their health. So those are some quick examples.
Yeah, the whole pet pharmacy experience is really interesting to me, because in a human being, right, you go to a medical doctor, they don't dispense medication. But when you go to a veterinarian, you kind of expect that. So to some degree, there's consumer education that needs to take place on their ability to choose where they procure the medication that's being prescribed to their pets, who are essentially part of their family. So I'm assuming that to some degree falls under your responsibility as well.
That's exactly it. I think more and more customers understand that it is their choice. They can choose whatever pharmacy they may want. They don't have to necessarily go through their veterinarian's office. And, if they do, and that's more convenient for them, that's fine. We're able to offer a very competitive experience and certainly a competitive price point on many veterinary meds. And the medications don't work the same way in animals as they do in humans oftentimes. And so what comes along with that is we provide additional education and ongoing continuing education to our pharmacists to help ensure that we're providing that level of pharmaceutical care to the pets that we do to our human customers as well.
All right, Kevin, let's shift to the concept of leadership. You have a very serious mandate in your role at Walmart overseeing health and wellness pharmacy. Would love to hear from your perspective, what are some of the principles you're guided by, and how does mentoring the leaders below you and the emerging leaders play into the principles that you've been following for success?
I appreciate the question. And, if I think about it, pharmacy school taught me what it means to become a healthcare professional. But if you ask any pharmacist why they went into pharmacy, it's always about the patient. Everybody loves to take care of the patient and that primary care that we provide. Similarly, it's similar to what Mr. Sam did. I'm sure you've read his book, but he talked about the fact that he wanted to do retail. That was his craft, his profession. But when you very quickly, you see that his passion was all about the associates and the customers. That's what he loved most. And so I think that's why today Walmart is a people-led, tech-powered organization. And, even our CEO, Doug McMillon, talks about it's our humanity that's going to allow us to win in the future. We have over 15,000 pharmacists across 49 states, and over half of them have been with us for 10 or more years. So we have a really strong tenure. And I think that's because our culture allows for that. We put the associate first. We know that they're the ones who are taking care of our customers. And that's the whole goal, is together we're working to make sure that we deliver for that customer. So as I think about my own skills, it may have started off just having training to become more skilled clinically. And as I grew in my career, I adopted more managerial skills or developed more managerial skills. And certainly it's been leadership for the last many, many decades. In fact, one of the principles of leadership that I ascribe to is servant leadership. And I first read about that in a John Maxwell leadership book many years ago. But that's the same term that Walmart's uses here with its leaders. So it really resonates. And our market teams, our regional teams, the ones that are there to help support our pharmacists and our technicians and our vision center managers and opticians are all like-minded. And so those core values, they come out in terms of what we like to talk about as RISE, right? Respect for the individual, act with integrity, serve the customer, and strive for excellence. And again, ultimately, it all comes back down to servant leadership. And so as I mentor folks in my circle, and as our leaders mentor folks in their circles as well, we all talk about how it is that we're here to support the stores who are here to support our customer. That's servant leadership. And that's what we do really well here.
I love that concept because I think about when you talked about the pharmacists that you have serving the communities, right? They're, to some degree, they really are servant leaders to their communities. And it's also interesting because the patients, your customers, right? In all likelihood, certainly for your customers that are dealing with chronic conditions, they're going to interact more with the pharmacy staff at Walmart than they are with their own primary care physicians, because they're not in there as frequently, but they're in your stores picking up their prescriptions on a fairly routine basis. And so, you're much more a part of their health routine than even their primary care physician is. And so that has a lot of responsibility assigned with it.
Yeah, you're absolutely right. Customers will talk to their pharmacist more than twice as often as they do to their physician, to your point. So, and we're a few minutes away. We're open late and on the weekends. So it happens.
That is true. Hey, when I think of Walmart these days in the retail industry, omnichannel is a word that always comes to mind. There is no retailer, and I mean that, there is no retailer that is more adept at omnichannel capabilities than Walmart. You touched on this at the beginning of your comments about the marrying of RX home delivery and pairing that up with the groceries that they're buying. How are you looking to shape the RX experience in omnichannel for Walmart consumers?
Great question, because I'd start by saying that customers expect more from their shopping experience. Again, putting prescription delivery or prescriptions into our delivery experience was something that was requested by more than half of our customers. And so they don't want to give up the in-store experience either, but everything's starting to shift. And if I think about kind of the historical growth of pharmacy, 7 in 8 Americans will say that they've picked their pharmacy based on convenience. And when you dig into that a little bit, convenience means how close is it to my house, and does it have something like a drive-through in case I don't want to jump out and go into the store. And so more and more that's shifting to, can I just get everything in a one-stop shop? Groceries, general merchandise, and can I have it delivered just in case I can't go into the store myself? I'm a great example of that personally. I love going into the store. I really do. But this weekend, I think I had 4 different deliveries to my home because I had guests coming over. I didn't have the time to go down to the store and get the stuff. And it really creates a convenience impact in your life. And so as people shop online more, the in-store experience is also changing a little bit. And we're investing in technologies like central fill pharmacies that allow our pharmacists and our technicians to spend more time with patients. And they're doing so around things like primary care, testing and treatment services is one example. And what I mean by that is if you think you have the flu or strep throat or COVID or something, in 21 states now, our pharmacists are allowed to not only do the diagnosis and the testing for that, they're also able to prescribe treatment for those types of ailments. And so far, we've seen a huge uptake in that where it's available. more than 75% of those encounters are taking place after hours and on the weekends. So again, I think convenience kind of takes the cake here. And as you think about delivery, it opens up a whole new set of use cases where if you're a caretaker for an elderly parent, but you live in a different state, you can still order your mom or dad's prescriptions to be delivered right to their door, especially if they're not mobile. If you have surgery that immobilizes you for a period of time. We had a customer in Virginia that had brain surgery, and she couldn't thank us enough because she was not allowed to leave the house, but yet we could bring all of her medicines to her. And so, I think that's the way we're changing and shaping pharmacy within that omnichannel definition.
Yeah, you talk about the term convenience. Convenience is a subset of value, right? Value is in the eye of the beholder. For some, it's about the price you pay. For others, it's, am I driving value because they're allowing me to live better, which is a motto I think we're very familiar with, right? So I think you're absolutely holding up to what the mantra of Walmart is. A reminder to our audience, today I have the great pleasure of speaking with Kevin Host. He's the Senior Vice President of Walmart Health and Wellness Pharmacy. Okay, so Kevin, I know that in April of 2024, you were named the chair of the National Association of Chain Drugstores. Those in the industry know NACDS, and I know its annual meeting for 2025 just concluded a few weeks ago. Would love to hear about your role at NACDS. What was expected of you in that role, and how did you seek to drive growth and transformation of the overall industry through NACDS?
Yeah, absolutely. It was a wonderful year sitting in the chairmanship position. I was very privileged and honored to have that opportunity to do it. And I love waking up and coming into Walmart and doing what I do here. I've been wanting to, and I've been working on evolving the profession for many, many years. But doing it with NACDS, it's literally the whole profession together working as one. And so NACDS has been advocating for community pharmacists for over 90 years. That's 30 years longer than Walmart has even been around. So it has an amazing, incredible legacy. You touched on this earlier, Peter, and called it out, but Americans use pharmacy more than any other healthcare setting. That said, we have reimbursement pressures from PBMs that are really threatening that access to care. And unfortunately, we've seen some of our competitors, some other chain pharmacies that have succumbed to that. And, obviously we've seen bankruptcies, we've seen store closures. And so, part of what I did, the priority that I had as chair is to really make sure that we were fighting together for meaningful reform to preserve pharmacy access for all communities. We have more than 800 zip codes in this country now that don't have a pharmacy. And, that's a tragedy. We have many, many more zip codes where there may be only one pharmacy in town. And so as you kind of step back a little bit and look at healthcare access in general, there's also a shortage of primary care physicians that is starting to, grow faster. We're going to be short somewhere between 80 and 90,000 primary care physicians over the next 10 years. And so things like testing and treatment are great and they're necessary though. But that's not even enough. So some of us at NACDS also took a look at what's going on in other countries, and we've seen that in Canada, pharmacists are treating a whole list of minor ailments that goes well beyond upper respiratory. We talked to the premier of Nova Scotia, who was very vocal in terms of, he said that pharmacists are helping solve some of those gaps in care that they're having in his particular province. We talked to officials in Alberta where they're raising the level of pharmacist to something more like a mid-level practitioner. United Kingdom is really similar, and they're even going beyond that, where primary care starts at a pharmacy. And so I could go on and on. But I learned a lot in my year as chairman, but also it really fed my passion. And ultimately, here at Walmart, we want to make healthcare more convenient. We want to build trust with our local communities. We want to increase access to care and improve drug affordability. And, I think NACDS could probably cut and paste those. Those are something that we all want to achieve together. But for Walmart, we're in a great position because we want to continue to stay relevant to our customers. As I mentioned, we've been in pharmacy for 45 years, so we continue to invest in technology that's going to improve care experience and enable our pharmacists to spend more time with customers and just, help them with their health needs.
Well, you touched on something personal to me, Kevin. You mentioned some of the learnings you had from Nova Scotia. My mother lives in Halifax, and to bring it full circle, I use a Walmart to have groceries delivered to her at her home from the store in Bears Lake. So I'm a big fan of what you're doing north of the border as well. So here at the CPG Guys, the linkage between loyalty and insights is something we discuss very frequently. Obviously, at Walmart, you have an enormous amount of data at your disposal. I'd love to hear maybe an example or so, but philosophy, whatever, around how you are leveraging the data assets you have to stay at the forefront of the pharmacy industry. And what's your vision for the future? What do you hope this data will do to help your customers live better lives?
We're very careful to use our data in appropriate ways. And I'll give you a great example. Central Fill Pharmacy, we took our time to ensure that when we got into Central Fill Pharmacy, which by the way was 15 years ago, we wanted to make sure that when we made that investment and ramped up our Central Fill footprint, we did so very thoughtfully. And we did it a little bit slowly at first, but over the last few years, we greatly accelerated that. It's because we had access to data and we had made the learnings that we needed to understand where we should invest and how we should invest. One of the key questions we had is, do we build many smaller facilities and spread them out across the country, or do we have fewer number but larger facilities? And then where would we put those? Where could you put those? It's harder to place a large facility in a community than it is in placing a smaller facility in certain communities. And so anyways, the data was really key in determining the design of that network as well as the location. And so, just recently we opened up our 5th Central Fill Pharmacy in Frederick, Maryland. And that is a site that's serving 17 states or will service 17 states and over 700 stores. It's an amazing facility filled with state-of-the-art automation, and it fulfills about 100,000 prescriptions a day. That's about 30 million prescriptions a year. And as of right now, we're the largest central fill operator in the U.S., or one of them at least, and we're continuing to grow that footprint. So by the end of next year, we'll have 7 of these facilities, and we'll be reaching supporting about 90% of our stores across the country, and that's in 45 states. So we're really proud of that. We've talked a little bit about pharmacy delivery. There again, technology teams were collaborating on that seamlessly to deliver that to our customers. And, that network is a really intricate network, and it's connected to Walmart's AI-powered delivery platform. We call it Spark. And so that platform uses new geospatial technology to help define where delivery catchment areas are and, put a lot of precision around that. So because we have that technology, just recently we expanded our delivery offerings to over 12 million more households. And so we just continue to expand our reach. Associates, we've got a lot of data and insights that we can leverage to anticipate when we're going to see spikes in pharmacy visits, whether it be seasonal like cold and flu or just back to school, or certain days of the week or certain hours of the day. And we have that baked into a predictive model that we use to help with forecasting the hours that we'll need to provide service to our customers, as well as the schedules that we'll need for our associates. So we're planning ahead, and we're equipping our associates with the resources that they're going to need to support those communities. So those are a few quick examples, but you're right, Peter. Data is everywhere here.
Kevin, for people like me who follow religiously the quarterly earnings results of Walmart, it's impossible to miss the contribution that the business units under the leadership of your colleague Seth Dallaire, notably Walmart Connect, have delivered to the organization. So my question to you is this. How is retail media, because I think about retail media and I think of non-pharmacy, right? It's endemic non-pharmacy items that are sold through Walmart. But how, if at all, is retail media starting to impact your team? And are there opportunities for health and wellness pharmacy to, and the brands that you're selling, because you do sell brands in many cases, how is that feeding into the ability of retail media to seep into your business?
It's an interesting question, because I think we're still trying to figure out, where the right fit is. But if you take a step back for a moment, we've seen patients, just generally, patients' trust in healthcare has declined. And this is a topic that's been discussed frequently in the media. That's happening at a moment in time where the incidence of chronic conditions is on the rise. And so there's a vital need for community level health support and resources so that people can live their best lives. And that's where pharmacists come in. According to the last Gallup poll in 2025, pharmacists rank as one of the most trustworthy professionals, even above medical doctors. And this is said often, but all healthcare is local. And so every community has different needs, and those needs are best understood by serving and being a part of a local community. That's our pharmacists. They live and work and know the people of that community. In fact, of our 4,600 stores and pharmacies, about 4,000 of those stores are in areas with a shortage of medical providers. And so what we have been doing and working on is working with manufacturers who want to bring awareness about their product and the condition that it treats. And so we're working with them on programs that'll bring mobile wellness centers into some of these communities, some of the most needed communities. They offer and support free health screenings, consultations, even access to immunizations sometimes. And so it's an awesome opportunity for Walmart to work with some of our key partners. And beyond that, just broadly, awareness. Most patients don't know that pharmacists can provide some of the services I mentioned earlier around diagnosing and treating upper respiratory conditions, or prescribing birth control in certain communities, or even prescribing HIV prevention therapies. So retail media is I think a really key facet to our future.
That's great. So let me close this out looking towards the future and thinking about consumer trends and technology trends that are of particular interest to you. And I'd really love to understand, your vision on where you think artificial intelligence and the different derivations of it can really help in the pharma journey of your consumers and your guests.
Determining the future use cases for AI is a high priority for us. And we have several work streams, as you might imagine, internally looking at that. And so AI has already made significant impact in other areas of healthcare. As I come into pharmacy, affordability is the top of mind for our customer, though. 3 in 4 Americans are very cost conscious. They're looking for ways to save money at the pharmacy counter. And while this involves zero AI, we've got $4 generic programs. We were the first to have a private label insulin like Rely On. But we also have Walmart Plus, which enables free pharmacy delivery to the vast majority of the customers that use pharmacy delivery services. And that's an area where AI is seeping in. How do we understand what our customers want and need faster, more efficiently? How do we turn that around and provide it to them as quickly as possible? Free delivery for Walmart Plus members is a great example of that. Convenience is another area. I talked about how 7 in 8 Americans choose their pharmacy based on how convenient it is for them. You pointed it out, convenience is the perception of value or a component of value. So when you see stats like half of women, over a third of men have reported delaying or skipping health appointments because they just can't get an appointment or it's a long wait time. When you've got something like the flu, you wake up in the morning, you don't feel good, and you might have a really important call or your kids are sick and you've got to get to work. That testing and treatment that our pharmacists can provide is really critical. And so 3/4 of those visits have happened after 5 p.m. or on the weekends, and they can be in and out with their prescription in as little as 30 minutes, or they can just head home if they don't feel good, and we'll send them their treatment along with chicken soup, blankets, tissue, whatever they may need. And so, all of that in some way, shape, or form is now being supported by AI. And I would say we're just getting started on that journey. So much more to come on that, Peter.
Thank you, Kevin. I appreciate that response. To the community that we are fostering here at the CPG Guys, we really want to thank you for the clicks on what we post online, listening to our podcast, likes, comments, direct messages, running into us at conferences, on airplanes, the streets of Tokyo, wherever it might be that we find ourselves. We are so incredibly grateful to you, to our sponsors, and to our guests who come on the podcast, because you're helping us educate and entertain this community and make us all better at the jobs we're trying to do, serving consumers. So thank you. It's amazing that we're closing in on our 500th episode, and we are 5 years into this venture that we undertook simply to kill time at the beginning of the pandemic. And who knew? 5 years later, here we are. But the show doesn't really exist without you, so we're really grateful to have you as our audience, as our partners on this journey of our professional careers. Kevin, thank you so much for taking time out of your day to sit down with us to tell us about the incredible work that's being done at Walmart around health and wellness pharmacy. It was a real honor to speak with you today. Thank you.
Thank you so much, Peter, for having me. I really appreciate the opportunity.
I know Shri is killing himself for having to miss our conversation today, but he can listen to it like everyone else who follows this podcast. But it was a real honor for me to speak with you. And with that, I'll say to our audience, thank you, and we look forward to speaking with you on the next episode of the CPG Guys podcast. Goodbye. The content in this podcast episode is provided for general informational purposes only. By listening to our episode, you understand that no information contained in this episode should be construed as advice from CPG Guys LLC or the individual author, hosts, or guests, nor is it intended to be a substitute for research on any subject matter. Reference to any specific product or entity does not constitute an endorsement or recommendation by CPG Guys LLC. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. The views expressed by CPG Guys LLC do not represent the views of their employers or the entity they represent. CPG Guys LLC expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, special, consequential, or other damages arising out of any individual's use of, reference to, or inability to use this podcast or the information we present in this podcast.